Okay, so it's me and Remy here. This is my cat. Um, I'm not sure if she's gonna stay the whole time, but I'm actually kind of curious because this is the first time that she's been in one of my reflection videos. So, anyways, you want to say hi to Prof. Castoso? Yeah. So, anyways, for my second day of adult health clinical, I had two patients. One was like a CHF exacerbation with like fluid overload. He really just needed inpatient treatment for like IV Lasix, just getting off that extra fluid, and um, managing high blood pressure with him. And then my other lady, she had a syncopal episode and was brought to the ER on the 8th, I believe it was. And then they found her to have like malignant hypertension when she first arrived. And then she had like an acute kidney injury that was related to like renal artery stenosis. So they ended up admitting her, and then after they admitted her, I'm not sure if she was just still having like the symptoms of like passing out or if she actually did pass out, but they ended up doing orthostat testing on her, and she ended up being positive for orthostatic hypertension. And so looking in a little bit to that is kind of like my research for this reflection. I kind of found that like orthostatic hypotension isn't really something, like it's usually, unless it's like dehydration or like they're on bed rest for a long time, a lot of times it's like an underlying cause. So like a lot of times they'll admit them to like try to figure out like what that underlying cause is. And one that really stuck out to me with her, I mean, it could have been like dehydration. It also can be due to they at the time were like kind of messing with her blood pressure medications. And a lot of times they said like certain like blood pressure medications, especially I think it said calcium channel blockers. Yeah. And ACE inhibitors. They sometimes can be used to like treat their high blood pressure, but it also can sometimes tank them when they're like standing up. Also, just as they're getting older, there's special cells called baroreceptors that control like our blood pressure. They can kind of slow down as we age. So she had even said to me like, I've never had this issue before, but like it makes sense that like as they're aging, sometimes like these things can develop. So it's really interesting to look at that. And also just like dehydration can do it to you, just being like hypovolemic and things like that. So it was really interesting to like look into those details. And then an education portion of my reflection, I went in to go do her glucose scan, and she was like, I don't have like diabetes, like I'm not really sure like why they keep checking like my blood glucose. And I was like, well, which this could be wrong, but the patient education that I provided on her was sometimes like a lot of like symptoms like feeling lightheaded, passing out, they can be like correlated with blood sugars, like super high and super low can sometimes correlate to the same symptoms. And I even told her like they're probably like, it may even just be protocol for that floor to be monitoring them, but like especially when she was first admitted, like it's a definitely like a important task to be able to know what that blood glucose is, to see if that could be contributing to it. And then for my spiritual aspects, according to Mary Elizabeth O'Brien in her book Spirituality and Nursing, she talks between page 112 and 113. She talks about how as nurses we can practice spiritual care. And the reason why I really wanted to look into this more was because it was a little bit of an awkward interaction for me asking her about religion. And I feel like that happens a lot. And, you know, it's like, I went to like public school, and like it was almost like you don't like talk about that stuff. So like I've always kind of like kept it to myself, but like also it's just such an important part of my life that like I want to share with other people, and I want to know, you know, if I can involve like spirituality in their care. And so she writes that the nurse may not know precisely which nursing therapeutics to employ when faced with a patient experiencing spiritual need. Simple guidelines presented in earlier publication may provide some ground rules for spiritual care. And then it even notes that the nurse must attempt to respect and understand a patient's religious beliefs and practices. Even if very different from his or her own, the nurse must take time to allow for the patient to express religious, ethical, or philosophical views, as well as fears and anxieties related to the patient's spiritual belief system. And so, like, that just, like, even, like, showed me that, like, just because I'm asking about their spirituality doesn't mean, like, necessarily that they're spiritual in the way that I'm spiritual. Like, there's most likely something that, like, they do still find spiritual. And, like, that's something that, you know, I may not know anything about, but I can still, like take that knowledge with me, and maybe like come up, you know, do my own research and like figure out a way that I can still incorporate what she enjoys and what she finds comforting during this time, and incorporate that into my plan of care. And I just thought like that really stuck out to me, because like I don't always like think like that. I always think like, because to me my spirituality is like Jesus Christ and like Christianity, and that's not necessarily for everyone. And you know, it's not wrong to ask somebody about their spirituality. And so that really stuck out to me. But overall, it was a really beneficial day, especially having two patients, just seeing like two different things. And I'm usually on the IMCU floor, so it was a different floor to be able to experience. And it was honestly just a very beneficial day. And I thank you for allowing me to join your group.